How does tPA medication work for stroke emergencies? Imagine a tiny rescue team rushing to save the brain from damage during a stroke. That's what tissue plasminogen activator, or tPA, does in emergency situations. When someone has an ischemic stroke, it means a blood clot blocks blood flow to part of the brain. This can cause brain cells to die if not treated quickly. tPA is used to dissolve that clot and restore blood flow, helping to reduce brain damage and improve recovery chances. tPA is a special kind of medicine called a thrombolytic agent. It works by targeting the blood clot directly. The clot is made of a protein mesh called fibrin, which stabilizes the clot and keeps it in place. When tPA is given, it binds to fibrin on the clot surface. Once attached, tPA activates a protein in the blood called plasminogen. This activation turns plasminogen into plasmin, an enzyme that breaks down fibrin. As fibrin dissolves, the clot starts to break apart, allowing blood to flow freely again to the affected part of the brain. Timing is everything with tPA. It must be given within a narrow window, ideally within 3 to 4.5 hours after stroke symptoms start. The sooner it is administered, the better the chances of saving brain tissue. Before giving tPA, doctors perform imaging tests like a CORT scan to make sure the stroke is caused by a clot, not bleeding. If there is bleeding in the brain, tPA could make the situation worse, so it's very important to rule this out. Not everyone can receive tPA. People with recent head injuries, bleeding disorders, uncontrolled high blood pressure, recent surgeries, or evidence of bleeding on brain scans are usually not candidates. These precautions are in place because tPA can increase the risk of serious bleeding, which is the main concern with this treatment. In summary, tPA works by enzymatically breaking down blood clots that block blood flow to the brain. When given quickly and under careful medical supervision, it can be a life-saving treatment for eligible stroke patients. Recognizing stroke symptoms early and calling emergency services immediately is crucial, as the effectiveness of tPA depends heavily on rapid action. Always remember, if you suspect someone is having a stroke, acting fast can make all the difference in their recovery.